Hi, this is Alan again with part 2 of suctioning a patient with a trach. The first thing I'm going to do is I'm going to set my equipment up while my patient is being hyperoxygenated on 100%. I've opened up my kit. I have my gloves. These are sterile gloves, so I have to use Sterile Technique. And I'm going to take my little box that I'm going to be filling up with water for irrigation. And I have my suction catheter, which has to stay in. It's in the bag, so it's still sterile inside. I'm not going to touch that yet. And I do have a saline bullet just in case. And this is institution directed. Some institutions do not want you instilling saline. Some institutions leave it up to the respiratory care department. So we will have that if we need it. We have some sterile water for irrigation. And I would take my water and I would fill up my box, and as I filled up my box, at this time I would open up my gloves, and I'm going to have to decide which is going to be my sterile hand and which is going to be my unclean hand or non-sterile hand. I hate using the word or term dirty, but I am dominant righty, so I'm going to use the right hand as my dominant hand. I'm going to pick up the glove and I'm going to slip this glove on. And I have pretty big hands, so it's kind of hard, but you're going to have to work it. And I'm not going to touch the outside of the glove at all. And then I'm going to pick up my other glove. This is going to be my non-sterile hand. Glove on, but I'm still trying to make sure that now I have my gloves. This is going to be my sterile hand. This is going to be my non-sterile hand. At this time I'm going to pick up my suction catheter with my non-sterile hand, and I'm going to reach inside. I'm going to pull out my catheter, and I will grab the catheter from the bottom, and then I'm going to wrap the catheter around my hand. I'm going to hook it up to my suction source, which has already been set at negative 120 centimeters of water pressure. I'm going to test my suction source, and it is working. At this time, I'm going to wrap this up with my hand. I am going then to take my ambu bag. I am going to step to the side, and I am going to hyperoxygenate my patient. And I have to do this for at least 30 seconds. I'm watching my sats on my sat monitor. I've got good saturations. It's been 30 seconds. At this time I'm going to take my suction catheter. I'm going to place it going down the ET tube. Once I meet resistance, I'm going to pull back a little bit. I'm going to put my finger over the thumb port, and I'm going to rotate, trying to limit this to less than 15 seconds. At this time, take my ambu bag that's been running with at least 10 liters of oxygen, and I am going to hyperoxygenate my patient again. I'm watching saturation. After each event, I need to hyperoxygenate and hyperinflate my patient again for 1 minute. I'm looking at saturations. I'm listening to the patient. If need be, I can feel to see if they need to be suctioned again. I can look at them. Sometimes you can see the secretions coming in. Or if you need be, you can listen to the patient. If the patient does need to be suctioned again, you can. You still maintain a sterile technique. You can use the same catheter and you can suction your patient again. Once you're done, at this point, you can disconnect your catheter. Clean your suction line, because you don't want to have a dirty suction line. Patient's now still getting 100% on the O2 from the trach collar, and now I would take this off, and I have completed my suction procedure.